I think being a doctor was in my blood. I've always wanted to be a doctor ever since I was a little kid, and that never changed, even to the time I was in college. And then I went on a mission trip to Brazil on Project Hope, which is a hospital ship that traveled around the world. And I spent 3 months down there, and I just saw some really amazing things that doctors were doing to help people. And it just reinforced my initial impression that being a doctor is what I should do. Ophthalmology, I kind of always steered away from that actually, and was more interested in orthopedics because I do have a love for skiing. I thought it'd be kind of cool to fix broken bones from people who were skiing. But I took an elective in ophthalmology my senior year in medical school, and it was truly the only subject that I got up for in the morning and wanted to get down to the hospital to learn more about. It was kind of like scuba diving or snorkeling for the first time, where you kind of look into a whole new world and you see these fish floating around. Well, when you look into the eye and you see all the structures that are in the eye that nobody else can see, it's pretty amazing. So it just stimulated my interest, and there I am. Well, oculoplastic surgery is a subspecialty of ophthalmology that really involves the eyelids and the tissue around the eyelids. And I kind of always liked plastic surgery, and I felt that I always liked working around bones and tissue of that sort, and it kind of fell as a natural thing. But more importantly, oculoplastic surgery is kind of like the field goal kicker of a football team. It's like everybody can see what you do. It's unlike being in the trenches on the line, where, you know, sometimes your work isn't always noticed, but it really, you sort of have to have a personality for that, where, you know, people know that if you screw up, everybody knows, not just that patient, and if you do well, everybody knows that too. So I kind of like the cosmetic side of oculoplastic surgery as well. Well, Wills Eye always had a really good reputation in terms of patient care, in terms of resident education, and in terms of research. And I've always wanted to be around people that wanted to excel in those three areas, and it's nice to be around like-minded people, and there's a real feeling of camaraderie here, which you really don't see in a lot of other institutions. Well, I like to ski. I've always been a big skier, and I have run a foundation, or I've run a fundraising campaign, a ski-a-thon. We're trying to raise money to build a new school for handicapped children. I do like to take mission trips and teach residents and others the importance of giving back. And tennis and other sports are always a good thing that I like to do as well. Being around friends and family, of course.